Welcome back to Live at 9. It's Wellness Wednesday, and we are joined with Dr. Quinn this morning. Surveys from across the country show that almost half of all adults are feeling peak stress. So let's just jump right into how we can deal with the rising stress with Dr. Quinn. Good morning.
Good morning.
What are the most common ways to decrease stress?
Well, before I even go there, I just want to articulate that so many of our patients are coming in. Like the lady this morning, her blood pressure was sky high, and she told me she only slept 2 hours last night.
Wow.
And the one before that, very similar. Everybody is stressed right now. But I did a great deal of research preparing for this presentation, and there are three main things that just kept popping up, one study after another. Number one, something that I do quite a bit, try to get exercise in, because what that does is it kind of relaxes your body. You don't need to go to a big gym and lift all these heavy weights. You can just walk in your neighborhood, like maybe 30 minutes. If you can, 5 days a week is recommended. But if you can't do that many, just do what you can. And, you know, like I swim, I have access to a pool at a gym that I belong to, and it relaxes me and it helps me sleep better. The next thing that they talked about were daily meditation techniques. So it's advised if you're someone like me that's spiritual, you know, you could just pray for 30 minutes a day and just kind of just let everything go. And as my mom says, give it to God.
Right.
That's a good thing. Or you could even just meditate. There's so many different ways to meditate, but if I went into that, it'll be a very long presentation. But you know, just get your mind off of it. And then number three, it's suggesting that you get that sleep, as I talked about a little bit earlier.
Right.
You want to get 7 to 9 hours of sleep. So before you go to bed, you want to take maybe an hour or two just to cool down. Like turn the phone off, TikTok, CNN, even WJTV, just turn everything off and just relax. Maybe read a book or just meditate or you know, praise, whatever you can do to relax. But don't just be all hyped up and then go to bed, because it's going to be hard to go to sleep.
Yeah, you'll stay wired, right? As you even lay in the bed, I find myself doing the same thing, but reading a book or kind of cooling down and getting your mind ready to go to sleep really does help you get in a better mindset to fall asleep and probably to get better quality of sleep as well. Dr. Quinn, this time of the year is really stressful for a lot of people with graduation, big life changes, and also in our economy right now. We have a lot of changes that may be causing some financial stress on people. What are some other common ways, causes of stress in our lives?
Well, I mean, you hit the big ones, the economy. A lot of people are losing their jobs, especially with these gas prices going up. People in transportation industries, even in the healthcare industry, a lot of people have lost their health insurance. And, you know, it's causing a lot of problems for even us here at Quinn Healthcare. But at the end of the day, if you just try to get your mind off of it and just do the best you can, you can get better results. And you know, a lot of people are having marital problems with all the stress, relationships. My last patient told me that her daughter lost her car, and she has to pick her up early in the morning and take her to her job at Walmart, and then go pick her up and take her home. I mean, it's just, it goes on, and I'm becoming like a psychotherapist now. But I try to stay positive for everyone.
Absolutely, Dr. Quinn. Like you said, I mean, there's so many causes for stress, but the bigger thing that we have to focus on is just how to deal with it, because there are going to be stressful situations in all of our lives. But like you started off this segment talking about, there are many ways to deal with stress. Also, I want to talk a little bit about, is there any treatment or medicine that could possibly help with someone dealing with a lot of stress in their lives if it comes to that?
Well, as a primary care doctor, we've been trained in our training to identify red flags. And sometimes some of these red flags mean prescribing some medication, maybe just to get the stress down or maybe help them sleep. But if they have severe red flags, we refer them to the psychiatry that are even more trained to give them medicine that might be more effective. And if we see the big red flag where they might want to harm themselves or someone else, we just call 911 and they go to the emergency room and they get assessed. And if it's true that they are at risk of harming themselves or someone else, they'll be admitted, which they might need.
Absolutely, Dr. Quinn. I mean, definitely crucial for this time of the year and really all times of the year as we're dealing with stress right now in all phases of our lives. So thank you so much for giving us that insight on how to reduce stress, how to deal with stress, practical ways that we could implement in our everyday lives.
Thank you.
All right, we'll see you again next week on Wellness Wednesday. And